considering a career change, but that tattoo you have from the 90s stands out more than your resume? Well, nearly 7 million adults nationwide have unwanted ink. But luckily, those regrettable tattoos of the past are no match for Cineron Candela's new PicoWay tattoo removal laser. Here today to share more about this new innovative way to get rid of tattoos is Dr. Terrence Keaney. He's an associate at the Washington Institute of Dermatologic Laser Surgery. Good morning, Dr. Keaney.
Thank you, Angela. Thank you for having me.
Oh, you're very welcome. Now listen, so many people get caught up in the emotion of the tattoo for whatever reason. And as I said in the open, they want to get rid of them. So they come to you. What happens?
So obviously we do a consultation, we examine the tattoo. We also go over the process, and when we're removing a tattoo via laser, really there's two things that we consider: the color of the tattoo and the length of time that's required to treat it. So the new PicoWay has a large advantage over older technology in that it has two wavelengths to target all colors, and it delivers the laser energy much more rapidly, allowing for quicker removal. So patients before would need 10+ treatments to get rid of that tattoo. 3 to 6 with this new technology is all that's required. So it offers a great advantage for our patients.
Okay, so let's go a little bit deeper. You said this is new technology. It depends on the color and the intensity of the tattoo. How does the body get rid of it? Like when you do what you do, what's that process?
So it's funny, most people when they come to me and they're asking for the laser to get rid of that tattoo, they think the laser gets rid of it.
That's
actually,
what I think.
Yeah, well, actually what it does, the laser actually breaks up the ink underneath the skin, allowing the body to remove it. If you ask a patient or a person with a tattoo, they'll notice over years that tattoo will slowly fade over time, because the body is slowly degrading it. But what the laser does is actually breaks it up, allowing the body to get rid of it much more rapidly.
Okay, so that's the process. And does it make a difference? Like if someone is darker hue to lighter hue, does it make a difference
Absolutely.
in the time and the process?
Yes, so patients with darker skin types, their natural pigmentation kind of shields the ink underneath the skin, so you have to use a wavelength of light that's, number one, safe to use in them, that won't cause a burn or a blister or a scar, and number two, that still matches the color that the tattoo that patient has. So, that's why seeing a dermatologist who specializes in lasers and has the appropriate technology to treat each individual's tattoo.
Yeah, you're right. I mean, the last thing you want to do is try to get your tattoo removed and end up with something, a scar or anything like that. Okay, so here we are. We're coming to see you, Dr. Keaney, and I've got this big tattoo. I want to get rid of it. And it might be really intense. What kind of time do I have to invest? Can you do it all in one shot, or can I come every single day to get rid of it?
I wish it was that easy. I mean, unfortunately,
I want the fast fix.
As I mentioned before, it usually takes around, with the new PicoWay technology, around 3 to 6 treatments. Each treatment itself, depending on the size of the tattoo, can take, 5 minutes upwards to a half an hour.
Okay.
It is a little uncomfortable, so we number patients during that visit. So we usually say, each session may take an hour to 2 hours. And then we repeat those treatment sessions every 6 to 8 weeks. We need enough time for the skin to heal, as well as the body to remove whatever ink that has been broken up from the previous treatment.
It's interesting because tattoos are still very, very popular, and some are just gorgeous, just in colors. I don't have any, but I know a lot of people who do. So what makes your tattoo removal system different from others? I mean, people say, all right, I'm just going to go get rid of it. Sometimes it works out, sometimes it doesn't. Tell us about this.
Yeah, so the PicoWay is really taking advantage of what's called the picosecond technology. So the laser energy is delivered in a trillionth of a second. So extraordinarily rapid delivery of laser energy more effectively breaks up the ink. But it's not just how rapidly this laser energy is delivered. The PicoWay also offers multiple wavelengths of light that we can fire depending on the colors of the tattoo. Traditional colors like reds, yellows, even flesh-color tattoos for, like cosmetic tattoos for lip lines and eyebrows, those have been really difficult to get rid of historically. But with the PicoWay, it has a wavelength of light that treats a broad range of colors, which is a very, it's a very positive development in the laser technology.
I would think tattoos around your eyes, that's a very delicate removal system.
It's a delicate area. Obviously, you need to shield the eye, so we have eye shields. It's not a the most common area that we treat our tattoos, but yes, people get eyebrow liners.
Oh yeah, even eyeliner I've seen.
Yeah, even eyeliner. Now those are those are a little bit more challenging. Once again, I would kind of recommend patients seek out practices that are used to or prepared to treat around the eyes, because you need to protect the eye.
Yeah, but the bottom line is this is brand new technology. You guys are doing it better than anybody else. So, yeah, good for you. So, you've got a moment. We're getting ready to wrap up, and you're speaking to your customer. Where do they find you?
So we're based in Washington, D.C. on K Street, 1430 K Street. We're what we call a laser institute, where we have over 30 devices, not just tattoos, but we also treat a variety of other conditions. But we're really excited about this new PicoWay technology. We've been treating tattoos for 10 plus years, and we've seen the evolution of the technology, and this is really kind of a game changer, because tattoos were tough, you know. You would sit with a patient and say, look, you might need 10 plus treatments separated over every 2 months. A patient looks at you and say, so you're saying it might take 1 to 2 years to get rid of this thing that I did late at night one time when I was 18? So, you know, this new technology has really allowed us to better serve our patients.
Dr. Keaney, thank you so much. There's good news for a lot of people who thought they were stuck with their tattoos. Thanks for joining us.
Thank you, Angela.